One second. Okay, done.
Right, it has started now.
Thank you,
We can
Shrishta
begin.
ma'am. Yes.
Thank you, Sujashna. So, a very good evening to everyone and a very warm welcome to today's webinar on managing endometriosis with dietary approaches, which is organized by IPN India Association, Kolkata chapter. I'm Khushboo Singh, and I truly feel honored uh, to be a moderator for this very insightful session. As we all know, that endometriosis is a very complex and often a very under-discussed condition that is significantly impacting the quality of life for many women around us. With growing research, the highlight of nutrition in managing of the inflammation or the hormonal balance and the overall well-being today is a topic and is both timely and it is very highly relevant as well. We are privileged that we have our esteemed speaker, Ms. Jyoti Pachisia, who will be sharing a very evidence-based dietary strategies and practical insights on managing of endometriosis. And I'm sure that with her help and her expertise, we'll be finding immense value with the discussion today. I also like to extend my heartfelt gratitude to our respected chairperson, which is Anindita ma'am. She ideally does not need any introduction, but she comes with wide 18 years of experience and is a senior clinical consultant dietitian. She is attached with multiple clinics around the city and she has many certifications as well. She has recently actually done her certification in psychology from the Yale University, United States, and she is executive committee member for the IPN Kolkata chapter. And not taking any further time, I would request everyone to please keep yourselves on mute throughout the session. You may drop all your questions in the chat box. We'll be taking it after Jyoti ma'am completes her talk. And with a further delay, I will just extend my heartful welcome to Anindita ma'am, and I'll ask her to take the session forward. Thank you for joining in. Hopefully, we'll be having a very enriching session ahead. Over to you, Anindita ma'am.
Ma'am, you're on mute.
Ma'am, you're on mute.
Thank you, Khushboo. And good evening, all. Good evening, my respected Nina ma'am and all my colleagues and friends and sisters, brothers, and whoever joined in this field. And I'm thanks a lot for IPN chapters, because IPN is a platform where we can share our knowledge, practice, and more awareness programs we should do in near future also. And today also our we can just put some effort for this manner. So this month, the March month, we globally celebrate the Women's Day. We are cutting cakes and all, we celebrating, we are taking gift and all. So
Ma'am, you're on mute somehow.
ma'am, you are getting one mute. That's right. Yeah.
Maybe
And
the
this month, in this month, this March month, we celebrate that Women's Day globally, cutting cake and taking gift and more than that. Then we thought we can discuss disease or painful problems at the reproductive age for the women who are suffering in this way. So our eminent speaker Jyoti today, so she thought like that, just webinar कुछ करते हैं जिसमें बहुत जन का pain हम लोग relieve कर सकते हैं, isn't it, ma'am? So it's a congratulations to Jyoti, because she took the initiative for this manner. Because I know personally many patients who are suffering from this problems, this endometriosis, our topic today, and those who are suffering, they are just traumatic, because at this entire reproductive age, they are just suffering. In US, we can say 1 out of 10 women are suffering these problems. In India, we cannot get that correct data. 45 to 50 million people are just affected in these problems. And this awareness and the data we should get more, because undiagnosed problems is that, because if this is a problem is the undiagnosed, then how can we get the correct data? So for this health practitioners and we are the nutritionists, we can do something for them. And that's the things we can make this webinar. And I can just not much more time I will spend with this elaborate introductions. So I can get that Jyoti's slide, and please show me the Jyoti CV.
Jyoti, please share your CV while slide.
Yeah, just a second. I hope my screen is visible.
It's visible.
Yeah.
We can put it on
Make it
Little
full
bigger.
screen.
slideshow.
Yeah. Thank you. You're most welcome, ma'am. Ma'am, you're on mute. Please unmute yourself, ma'am. No, no, no. I'm not mute. Okay. But I cannot see your CV. So just show me. Ma'am,
It is showing.
it
It
is
is
showing.
actually
Okay.
visible.
Yeah. So, Ms. Jyoti Pachisia, she's BSc, MSc, PG diploma in applied nutrition from JD Birla Institute and certifications from the NDP course for the diabetic educator course. She completed the certifications on renal nutrition from FSTN Explorations Foundations and formerly attached with the Genesis Hospital, Koshpa. She's a special lecturer in Institute of the Gokhale Memorial Girls College. She's a faculty at Navast Institute of Nutrition and Dietetics, Ghaziabad, nutrition and diet experts at the NutriTalk and can you please make it bigger because it's a Aadhaar cut. Ma'am, it is in the full nutrition's. Okay, content writer is a being and the parents.com presented and published scientific papers and lifetime members of the NSI IPAN Kolkata chapter FSTN Explorations Foundations felicitated as a dietitians awarded by the Indian Woman Global Award July 2023 and felicitated the young researchers by again dekha nahi ja raha hai, felicitated as a young faculty awarded by the FSTN foundations. And I know another quality she has. She's a great poet. I think after completing this webinar, we everybody have some surprise. Okay, so now don't want to waste more time. So Jyoti, over to you. You can start your webinar. Okay. Thank you so much, Anindita ma'am, for this warm introduction, though I don't deserve this so sweet introduction for me. And thank you, IPN Kolkata chapter. Sudeshna ma'am, you're here. Thank you so much, ma'am, for giving us this opportunity to present such a hyperlooked, or rather I would say use the word overlooked topic, overlooked issue, which is considered as the one of the most underlying subject right now in the women's health whenever we talk about. So without wasting any time, let's begin. Let's learn, let's know, and let's regrow ourselves and more meet people aware about the endometriosis. So what is endometriosis? Yes, sir.
If you don't mind, can I interrupt? Just you are talking from some other device and your video is on from the other device. For the recording purpose, you will not be seen in the recording. That's why I'm telling, is it possible to do from the same device? You can switch on your recording.
Okay, sir, just give me a moment.
जिसमें आपका वीडियो दिख रहा है उसी का ऑन कर दीजिए, बस हो जाएगा. Perfectly you are audible, visible. Sorry for the interruption. Sorry to all.
My slide is not visible, sir. Is it something problem?
Slide
is visible.
Slide is visible.
It's वाले उससे you are using the audio, no? Sir is saying the same one जिससे video on है उससे audio on कर दो.
अच्छा,
जिसमें ज्योति पचेसिया दिख रहा है, हाँ उसका ऑडियो ऑन कर दो. आप क्रोम में जाओ, ये ठीक है, क्रोम में जाओ, पीपीटी के बगल में जो आपका फोटो दिख रहा है क्रोम का लोगो, उसमें जाओ.
Am I audible now? Yes, yes, you are audible.
एक मिनट, आप दूसरे डिवाइस से ऑडिबल हो.
Go to Google Meet from this device.
Just a moment.
गूगल, हाँ गूगल में जाओ.
On the audio from here.
अभी हाँ वीडियो ऑन करो. इसका वीडियो ऑन कर दो. Otherwise, Khushbu, let her do. You should not interrupt.
Actually, I guess na if there is an issue with her device, if she
No,
will on her
okay, okay.
video,
No,
then
no, no.
presenting में कुछ
चलो,
issue आ सकता है, I think.
ठीक है
चलो,
अभी
चलो, चलो,
हाँ
आप
चलो
कंटिन्यू करो, कंटिन्यू
कंटिन्यू
करो,
कर
कंटिन्यू करो, कंटिन्यू whatever. Sorry, sorry for the interruption. Sorry, आप पीपीटी में चले
ज्योति
जाओ
स्टार्ट
बिल्कुल.
करो
Sir,
हाँ.
it's not happening. I think something is
Jyoti,
wrong in
let's
that
do it that
network.
way.
जरूरी.
I've told
no
sir the
problem you
issue
show
you
your
face.
slide you
I've
show
told
your
sir
slide
the
No,
issue that you
earlier
face.
it was okay.
yeah
Earlier
yeah
it
yeah
was okay, Jyoti. So you can continue like this only.
Continue only.
Okay, okay.
बस slide show में डाल.
अभी ठीक है?
हाँ, perfect, perfect.
Okay, okay, okay. So,
एकदम.
okay. So let's start about this thing. Now, usually when we talk about this issue that is endometriosis, we generally use the particular issue that is called the painful periods. Now, where this painful periods comes from, where does it actually starts from, we need to know a bit of the regular menstrual cycle which happens. I'm not going much in detail because we all are aware about what are the different phases of the menstrual cycle. What is the day length? It is happening between 21 and 35 days in length. And during each cycle, the lining of the uterus becomes thick as a woman's body prepares for the pregnancy. But if it is not happening, then the uterus sheds its lining, causing a period, and that begins the start of a new menstrual cycle. However, in endometriosis, it becomes a little difficult. Why? Because the cells from the uterine lining, that is, I'm talking about the endometrium, grows in the other parts of the body. That is typically seen in the pelvic cavity, bladder, bowel, or uterus. And now more researches are being done where it has been also proved that yes, endometriosis is also happening in other places as well. And that is why the type of the endometriosis also starts to happen. Now, funny fact is that endometriosis affects major part of the body, but except the spleen. The reason behind why it is not affecting the spleen, because spleen is somewhat located in the upper part of the pelvic cavity. So somehow spleen becomes a safe, but otherwise the endometriosis, in the endometriosis, not only it causes bleeding, inflammation, scarring, adhesions is happening, but majorly the other parts of the organ is affected. And that is why we come across different types of the endometriosis. Like we have bowel endometriosis, we also have uterine endometriosis. We even also see patients coming up with the endometrial cyst as well. Like we have aware about the PCOD, PCOS, but we also, there is something called endometrial cyst as well. Now, endometriosis at the beginning, I think Anindita ma'am also mentioned that this data is quite low when it comes to our country. That's very true because most of the time, endometriosis becomes underdiagnosed. Now, this is actually a newspaper cut which actually has highlighted the line that endometriosis affects 2.5 crore women in India, out of which 1.5 crore or every 100 women is actually suffering, and 1.5 crore women are getting underdiagnosed, means they are not even aware about this thing, that this is something called endometriosis. And as per the WHO stats, the condition is believed to affect 10% of the women worldwide who are of reproductive age. This is back 2 years back. This is the newspaper cut, and today's time, if you see, guys, it's nothing the difference, because still we are failing to diagnose the endometriosis in a proper aspect. And not just this, there is also lack of awareness among the general public as well. Now, let's know this. Why it remains underdiagnosed? It's very difficult to diagnose. I'm sure you people are aware, agree with me that endometriosis ऐसा तो नहीं कि fever के जैसे हम लोग को detect हो जाएगा. It's not like that. It not even, it's just like a cough and cold also, that it will be diagnosed like that way. The problem is that even there are certain factors where, for this reason, endometriosis becomes quite a difficult one, quite a difficult to diagnose also. Like we have something, there is something called contraceptives. Contraceptives causing hormonal suppression of the symptoms. For this reason, this is only considered as one of the prime reasons also. Another aspects or another factors for which we say that condition often gets underdiagnosed is also the using of the improper diagnostic tools. Then also use of the non-discriminating examination. And our so-called societal attitude where we say, don't think it, this is just a pain, ease ho jayega. Think positive. Think, like say, please, let's not make this as a like a think positive. Endometriosis is not a psychological or a psychosocial disorder. It is a real medical condition which requires complete attention, complete medical attention. And our role as a dietitian comes up when it is a matter that yes, it is can be diagnosed. So we need to reframe and we need to make sure that her diet must be accurate enough to heal that problem. Now, usually, another confusion arises when we talk about the endometriosis, which is a similar aspect we see, is the adenomyosis. Now, what exact difference is coming? Endometriosis is happening outside the uterus, but adenomyosis is something which is the growth of the endometrium into the wall of the uterus. So, the right diagnostic tool is need to be made to assure that that is endometriosis or which is the adenomyosis. Now, let's understand about this more into details. Now, to know the pathophysiology behind the this emergence, or you can say the development of the, this one endometriosis, there are certain theories behind it. At college days we were studying, that there are certain theories which which are believed to be that this could be a possible reason for the pathological condition of this or the pathogenesis of this. So we also have for the endometriosis the different theories there, of which regurgitation theory is considered as the most favored theory among us all. We, apart from this, like we have the benign metastasis theory, metaplastic theory, extrauterine stem or progenitor cell theory. But retrograde theory, or if I say regurgitation theory, is considered as one such important aspect not to be neglected, because as we just came across that endometriosis takes place in the pelvic cavity after retrograde menstruation. That means endometrial cells reflux through the fallopian tubes. So the hypothesis out here is that endometriosis may develop when there is a decreased clearance of the viable endometrial cells from peritoneal cavity, which could be a probable immunological factor. And that is the reason why these patients have weakened immune system. They faces several immunological symptoms also, and there are certain more studies are being conducted where in relation to immunological system or immune system, which can predict the outcome of the endometriosis. Coming to the other theories like benign metastasis theory, it's happening, they says that it can happen via blood vessels and lymph also. Metaplastic theory, mesothelium of the pelvis and abdomen undergo metaplastic change into the endometrium. And last but not the least, that is the extrauterine stem, where it actually mentions the stem cells of the bone marrow are circulating differentiates into the endometrium. So every theory has a some of the logic behind which can lead to the pathogenesis of the endometrium. Coming to what are the symptoms which is associated. Now, to understand that what could be the symptoms of the endometriosis, there are 7 Ds associated with the symptom this endometriosis. Now, what are those 7 Ds to be highlighted? The 7 Ds include dysmenorrhea, that is the painful periods. Then we have dyspareunia, which is the pain during or after sexual intercourse is another frequent symptom. Then we have the dysuria. We also have the dyschezia. Dyschezia is actually another symptom is associated. Then we also have dysfunctional uterine bleeding. It's also their difficulty in conception, that is the pain during ovulation. Some individual experiences pain during ovulation, pain in their thighs or even on the legs as well. And also at the same time, the last but not the D, the seventh D is diffuse abdominal pain. Diffuse abdominal pain. Apart from these, there are other symptoms associated, which is also seen in context to the pathogen, in context to the endometriosis. And what are those? It's the infertility. It's a quite complication, you can say, fatigueness, even the gastrointestinal symptoms also, and somewhat the other way it has been seen that the psychological symptoms like maybe a low mood, anxiety, even depression is being seen accompanied with the endometriosis. Now, infertility, if we talk about or if we take it into consideration as a complication of the endometriosis, then I am sure everybody will agree with me, because right now in this 21st century, infertility cases are rising like a bonfire. I'm sure everybody will agree with me. Yes, infertility is like 1/3 to 1/2 of the women with endometriosis are facing difficulty in getting pregnant. And the main reason is the development of the endometriosis, and it can be based on that. It is of actually of different types. It is like this infertility is actually considered three different types, like peritoneal endometriosis, ovarian endometrioma, and the deep nodular endometriosis. For pregnancy to occur, an egg must be released from an ovary, travel through the neighboring fallopian tube. It becomes fertilized by a sperm cell and attach itself to the uterine wall to begin development. Endometriosis, actually, what does it do? It obstructs that. It actually obstructs that and keeps the egg and the sperm away from it. That's where the infertility problem begins. This is another case, most important, again, overlooked thing, because this endometriosis, when remain underdiagnosed, and by the time it is detected, like I would share a practical experience into this, my real case actually. One of my, you can say, maybe a cousin, you can say, dur ki rishtedar actually. She, by the time her endometriosis got detected, she was also being shown that she has also been showing certain malignant symptoms as well. Means after biopsy, it came across that she has reached the stage 1 endometrial cancer. So it's quite shocking, because she was not facing symptoms. But when we had a brief discussion about, then we came to know that there are certain epidemiological risk factors associated, and also thanks to the genetic interaction today, that this endometriosis can even convert into the endometrial cancer. Infertility case, too much exposure of the estrogen, early menarche, obesity, anovulation, diabetes, hypertension, shared risk like increased incidences of the endometrial hyperplasia, and also in the women with the endometriosis. Even too much exposure of the exogenous estrogens, like I'm talking about xenoestrogens. Xenoestrogens means they mimic the estrogen activity. Then we have also certain epigenetic changes like DNA methylation, histone modification, miRNA, angiogenesis, chronic inflammation. All these can couple together, leading to this particular complications. Now, there are certain myths and facts in context to the endometriosis. When we say period pain to normal hota hai, period pain is normal, you must have a low pain threshold. You do not have the tendency, you cannot grip that pain. The real fact is severe pain with menstruation is not normal, and it can be caused by endometriosis or other related conditions. Everyone who has endometriosis has a severe period pain. False. Many individuals have no symptoms at all. It depends from the person to person, and that is why the dietary treatment or any treatment, if we talk about whether it's a surgical based or non-surgical based, it may vary. Having a baby will fix endometriosis. This is another, I would say, a very vague thing, vague sentence actually, because endometriosis symptoms can appear to improve during pregnancy due to changes in the hormonal levels. But however, this is again very temporary and symptoms recurrence can occur. If you have endometriosis, you can't have children. But if the real fact is, most women with endometriosis are still able to have children if you are taking the right treatment at the right time. Another thing is, a hysterectomy will cure the disease. It's not necessary. Surgical aspect will alone will not do it. If it is detected at the early stage, then even diet can also help you out. Now, what is the possible current treatments? Previously, analgesics and analgesics like naproxen, then NSAIDs were used to ease painful menstrual cramps. And also, we have hormonal therapy that I'm talking about, the HRT, which will help to slow down the endometrial tissue growth and will prevent the new implantations of the endometrial tissue as well. But let me make it a clear point in this. Alone, these therapy will not help. We need to have a therapeutical approach. Like these are the certain agents. Like if I say progestins, we have GnRH analogs, danazole. These are the certain agents which can actually help to ease the pain which is associated with the endometriosis. Coming to this one, hormonal contraceptives like birth control pills, patches, vaginal rings, they are known to control the hormone responsible for the buildup of endometrial tissue each month. If I talk about the GnRH agonist and antagonist, they are known to block the production of the ovarian stimulating hormones. Coming to the progestin therapy, various types of progestin therapies are being used. Today we see devices, today we are seeing technologies are used. They are known to halt the menstrual periods and also known to grow the endometrial implants as well, which can help to relieve endometriosis to certain extent. So these are the certain treatment options, but apart from the drug therapy or hormonal therapy, yes, surgical therapy along with that can also be helpful, because remember one thing, your uterus is about the size of a lemon, while your ovaries are the size of the almonds. So if you have a disease like adenomyosis or fibroids, your uterus may be bigger. And if you have endometriosis on your ovary, it may be even bigger. And we cannot predict what could be the size also. And we cannot imagine rather. So which are the surgical options which are recommended for the endometriosis? We have endometriosis resection, that is hysterectomy. But again, yes, it is helping to removing all those visible implants while leaving the uterus and other organs in places. There are some more surgical options are coming up. Like latestly, we have the Da Vinci system. I'm sure you people have heard about this Da Vinci. The moment you are hearing this, Leonardo da Vinci, the history may back then in the history, but it's not that Leonardo da Vinci. This is only Da Vinci system. This is the Da Vinci system is like minimally invasive surgical option where only few incisions are being done and using a 3D high definition vision system and very small instruments which are tiny, wristed actually. They actually known to rotate for the greater than the human hand, and they are even more precise with enhanced vision and control. But again, unfortunately, this is very rare in India. So most of the time, laparoscopic or becomes an option at times because again, this is a very expensive one. But yes, maybe in later on, this surgery option can be introduced. Coming to the exercise therapy, let me ask all of you, do you believe exercise is very helpful in all the aspects? How many of you agree with this? You can unmute yourself.
I do agree with what you have said.
The reason is endometrial. If we talk, if not just
You
if we
can
talk
show
about
some
the
sign also.
yes.
Those
So
who are agree with this, so they can just raise their hands or shine up also.
thank you so much for the responses. Then this is such a beautiful thing that all of them are taking such it's an attention about this. Wow, that's great, amazing. So, yes, exercise can even be helpful. And guess what? Aerobic exercise has been found a very beneficial way to protect the women with confirmed endometriosis. It has been seen in the researches that women who exercises 4 hours a week or even more reduces the risk of endometriosis by 65% compared to the women who exercise less than 4 hours a week. So, because not just it is helping you in improving your performance, but it's boosting your mood of the performance. वो बोलते हैं ना, अगर आप थोड़ा सा भी walking करो, तो your mood is actually becoming better. So yes, the ones who has some psychological problem, for them especially with endometriosis, exercise really helps a lot. If we talk about meditation, you love tennis, please go and play tennis for 1 hour. If you love to swim, go ahead, because it has been seen that it reduces 76% of the endometrioma risk. But the one thing which you need to do in the check-in thing, rather you should make a checklist on the type of the intensity exercise, because this is a very common thing that happens, that we generally, when we talk about the exercise, just a second.
Even blood circulations also improve after doing the exercise in a month. So
Yes.
abdominal cramp is also will be less.
Yes. Like, just a second, mom, I'm joining. I think I've got
Yeah, no
logged off.
problems. Take your time. Actually, we, the nutritionist and the lifestyle modificator, we are doing a much bigger role for this, handling this case, because the patients is coming with the endometriosis after diagnosis from a gynecologist, they're sending to us. And first of all, we have to encourage them and counsel them, because they are totally demotivated. They don't want to do anything. Today the mood on and next day the mood off. So these kind of patients we are handling, and we have to be uh, role model, or we have to show the good path, जिसमें उन लोग हम लोगों का पूरा लाइफस्टाइल मॉडिफाई करे, प्रॉपर डाइट ले, क्योंकि ये तो लॉन्ग टाइम्स चलेगा. एंडोमेट्रियोसिस एक दिन में ठीक नहीं हो जाएगा. इवन सर्जिकल प्रोसीड्यूर के बाद भी इट कैन कम्स अप. सो उनको मूड ठीक करना एंड थोड़ा सा motivate karna is very much important for this
And
in this one.
also the most, just a second, mom, I think I got muted. Just a second.
Now you are unmuted. It is fine.
You are audible, Jyoti. You are
Audible,
perfectly audible.
Jyoti.
Okay,
Going
okay,
on.
okay. Chalo. That's fine. I thought I'm got muted.
No,
Anyway.
ठीक है. चलो.
Okay, so coming to the intensity of the exercise, let's not forget that when we are saying aerobic exercise karna chahiye, you should actually go for the walking, you should go for the swimming. Do not forget that even too much vigorous exercise is also not good, because that makes you completely drained, and that results in the extreme pelvic pain, and later on it might worsen the digestive symptoms, if any. And might also, it's been found, it might affect emotionally, overwhelming. It's like we seen a too much overwhelming ho gaya, too much ho gaya aaj to sab kuch ka. So it's actually, we need to check this out, that even if we are recommending exercise, what type of exercise is given, and for how long it is given, and what is the type of the exercise is given. Start with the always with the little one, with the warm up one, with the fresh one, so that once it becomes a little vigorous, the person can actually catch this out also. There are certain yoga poses which has been really helpful for ease down the endometrial symptoms, like restorative goddess pose, which helps to relieve the pelvic pain, reduces abdominal tightness, balances nervous system. Happy baby pose, that is balasan, which is known to release pelvic floor muscles, inner thighs and hamstrings. Again, child's pose, which gently stretches your spines and helps to alleviate the tension, cramping, and also the stress. This relaxing pose, which we call it as the Supta Badh Konasana, it actually is known to calm down the nervous system, a great yoga pose for the ones who have a depression problem or any other psychological issues. Could be any symptom. If you have a too much anxiety also, that is also help you out. It helps in tightening your hips, pelvis and inner thighs also, and reduces pelvic discomfort also. And it is always advisable to include low to moderate impact workouts like brisk walking and even cycling as well. Now, let's come to our favorite part, rather, it's all our thing. That is, what is the role of the diet in that? So, when we talk about that, how to heal endometriosis through the diet, the first thing we need to make sure of this, that you cannot reverse it. Like one of the myths and facts we just came across, that you can reverse endometriosis. It's not that thing. Yes, if it is detected in the early stage, then with proper lifestyle habits, you can actually lower down the symptoms to a great extent. And the aim of the diet to help endometriosis is based on four hands: nourishment, heal, support, and last but not the least, the balance. Because when these four hands are in balanced way, बोलते हैं ना कि चार हाथों का संगम रहेगा, so that will actually help to improve a lot from all the ways, while also reducing estrogen, toxic load, bloating, cramps, pain, and many more. So let's dive into it. Usually, when we talk about the diet, this is actually taken from a research paper, since I prefer to more of the research studies in this. So, when we talk about the diet, first and foremost thing, there is no general diet for endometriosis. Please mark it into one way, that there is something called individual perspective. Rather, I use a better term for this: precision nutrition. I'm sure everybody will agree that there is nothing called कि एक simple plain diet chart दे दो उससे काम हो जाएगा. It's not that. For everyone, there is a different thing. For example, if somebody develops gastrointestinal problems, like maybe the person has developed certain problem towards the gluten, or maybe like it's not able to digest the dairy products. So for them, maybe we need to, for the time being, we need to cut down the dairy products or the gluten-free diet. So that will actually help to overcome the overcome the problems associated with this. In fact, it has been found that the diet, which is sometimes like for the endometriosis, there has been a complications arising in context to the IBS as well. So for them, FODMAP diet is highly recommended. But yes, again, it depends from the individual to individual, because that is being seen, not only it improves the intestinal mucosal permeability, but at the same time, it reduces the chronic pelvic pain a lot. Coming to this one, that inclusion of the anti-inflammatory units like nutrients, then we let's not forget our probiotics and prebiotics given by other forefathers, other the natural products. They are actually known to improve the enzymes, that especially beta glucuronidase enzyme, by means of the short chain fatty acids, which will not only help to in the estrogen detoxification, but also reduces the endometrial lesions. So in a nutshell, if I say, every certain food component has an individual role when we talk about in the management of the endometriosis. It's just that you need to understand that what patient has come up to you with these symptoms. It's not necessary that a individual with without IBS but has a problem of endometriosis, you will give them FODMAP diet. That's absolutely wrong. You need to understand that, and then accordingly you need to plan it. It doesn't have to make like a tailor made. You have to make it in a very customized way. So yes, there are certain elements. Now, when we talk about macro elements, I'm sure everybody understands that macro elements means something which is required in more than 100 mg. So there are certain beautiful minerals which has given equal contribution in the management of the endometriosis. For example, calcium, magnesium, phosphorus, chloride, sulfur, sodium, potassium. Usually we get scared when we hear the term that sulfur is helping. But yes, it is a true thing that sulfur is known to, it's actually involved in the detoxification process in the liver, which is highly beneficial for hormone regulation. And also it is important for the collagen synthesis, which will help in tissue repair and maintenance. Coming to the magnesium, magnesium is known to rather relax the muscle fibers, which can help in alleviate the menstrual cramps and the pelvic pain also. Sodium, potassium, it will help to maintain the fluid and electrolyte balance as well. Coming to this, like the fiber, dietary fiber. These as I mentioned, that we see different types of the endometriosis, and one such type is the bowel endometriosis. So how to heal that? We need to make sure that the person is including good amount of the dietary fiber. That is the right quality of the dietary fiber, which we'll be getting from the different fruits and vegetables, which are known to reduce the estrogen reabsorption and also at the same time help to maintain the gut microbiota in such a way that it will reduce the inflammatory symptoms. Dietary fiber, at the same time, it has been seen that from the, if I say from the endometriosis theory point of view, it has been said that fiber intake contributes to the lower systemic estrogen exposure, which is a key factor in the pathophysiology of endometriosis. In fact, it has been seen that not just there is a immune mediated responses, but also at the same time, it is also reducing the oxidative stress as well. Now, coming to the animal fats and inflammation, there is a myth always being coming around that we should be start adapting more on the plant-based diet. It's not that. Not every animal fat is bad. Let me make it very clear. If it is coming from the dairy products, or if it is coming from the even from the animal sources, like if I talk about the chicken, if I talk about the fish, no, it is not like that. All of them are actually not a culprit. Why? The reason behind this, animal fats contains a specific this animal fats contains a specific, you can say particular protein, which if you take it in a moderate amount, particular protein, like if I talk about myoglobin, or if I talk about the other amino acids, if we say, so if you are taking in a moderate fashion, then obviously it's not going to be a culprit. Rather, it will be always favored as an endometriosis friendly diet. Like lean cuts of the meat, you should understand that what should be which part of the meat should be taken as a consumption, which will help to relieve that. Like we have the leaner cuts of the meat. There are various ways the meat is cut. Minced beef, leaner section, also like a fillet steak, over pork. Consuming more of the like fish, that is also really helpful. Coming to this oil, that what oil is suggested. This is a very, again, a which thing is obviously seen, because usually when we talk about the oil, we actually say that yes, olive oil is good, This extra virgin olive oil, cold pressed olive oil is very fine, but one should always look after the proportion, rather the ratio of the omega-3 and omega-6 fatty acid. And unfortunately, olive oil, corn oil, sunflower are not considered as the healthier choice, especially for the endometriosis cases. Recently, the researchers has proved that linseed oil and the rapeseed oil is actually considered even more healthier alternative comparatively to those inexpensive options like sunflower oil, and it is equally advantageous not just for the endometriosis, but also it has been found really helpful for any gynecological disorders faced by the female. Obviously, it is being said to avoid the trans fats, especially the fats which is coming from the ready to go meals or ready meals, because they are actually known to promote inflammation. So yes, omega-3 fatty acids, the researchers have been continuously coming up, which has been always proving and saying that they are known to decrease in the risk of the endometriosis development. And if we talk about how, then yes, there are following pointers. If you can see, maintenance of the cellular mechanism is there, hormonal production including prostaglandins, then we have the facilitation of the optimal nervous system, likewise many other functions. It's actually, you can say it is actually a very good friend. It becomes a very it gives the positivity to impact the hormones, and also calms down the pain as well. Recent researches have shown, and now it is becoming a that talk about the vegan alternative for the treatment of the endometriosis. Yes, I'm talking about the red algae. The ones who are following a vegan diet and abstaining from the fish consumption, red algae offers a valuable solution. Not because it typically provides omega-3 fatty acids, DHA, and EPA form, and it is available in dried crunchy flakes, and it can be really a versatile addition to your culinary recipes. It complements great with the vegetables and the soups, and especially if you are, you're not cooking too much, but actually if you are just adding as a topping, then it is the benefits is getting more like, you can say it's more beneficial. Now, coming to the regular fish consumption, again, as I mentioned, that not every animal source is bad. Fishes are considered another good option because, as we saw, the vegan alternative, so fishes have been considered as good sources of omega-3 fatty acids, which has been known to reduce the inflammation. Coming to the part, yes, many people have this misconception that caffeine should be avoided. Rather, we can say that caffeine is really, it's going to be a troublesome for the endometriosis patient. But the real fact is that overconsumption of anything, if I talk about caffeine, if I talk about alcohol, if I talk about of any sources, it is going to be trouble. So over here, higher quantities of the caffeine intake above 300 mg per day may be possibly associated with the disease. And the type of the coffee which is highly recommended is the filtered coffee with or without milk, again without sugar, and the ground coffee, means the freshly ground coffee is considered beneficial. But however, if you come across about the instant coffee, and these days we are getting fascinated with the decaffeinated coffee, which is made from the chickpeas, or if you talk about the methi seeds, it is not going to beneficial. It has been found that it has been found increasing inflammation. मतलब benefit की जगह उल्टा आपका काम बढ़ा देगा. So if you are choosing coffee, it's fine to choose, because one small cup is not a big problem. Yes, those who love tea, if you want to enjoy tea.
जस्ट थोड़ा सा इंटरप्ट कर रही हो ज्योति, मतलब एक स्टूडेंट क्वेश्चंस किया है, अगेन द कॉफी विद द घी, तो ये थोड़ा सा क्लियर कर दो अभी अभी, जो व्हाट इज द माने बेनिफिशियल फॉर द कॉफी विद द.
It's a wrong thing, dear. Ifra, your that coffee with ghee, coffee with olive oil, coffee with lemon juice. I think this is something which is a vague combination which has nothing to do with it. If you
Absolutely.
want to enjoy coffee, please enjoy solely coffee, because it has because there is no scientific evidence which has actually proved that coffee with ghee is going to really help a lot. These I understand, because there are, I'm not blaming the celebrities, because they are also getting, idea come from the people, but getting fascinated from that is say better you get fascinated by the research what they say.
And not
Even
with the snacks also, right?
exactly.
So,
Now, lately, I think one day before I came across about the fact that people are using lemon shots into which olive oil is added. My goodness, it's such a deadly combination, that olive oil with lemon shots. I mean, how can people can think about it? That into in the raw form. So my point, my always a suggestion is, do not actually recommend any such a deadly combination like this. If you want to add omega-3 fatty acid, find out the other sources. Like we have the flax seeds. We have so many options. Why coffee में घी? ये तो हो गया आग में घी डालने वाला बात. Okay. Okay, coming to the this one, green tea. So if you love the tea, okay, fine, you can have tea. Black tea is a good option. Green tea is even better option, because it will help the healing flow. But if you if you know, today in today's time, matcha is being like ruling around the world, and I would say answer is no. Matcha is not a good friend for endometriosis. Rather, green tea or the black tea without sugar is really helpful in a longer run. And actually, it has been really found helpful not just in the hormonal regulation, but somehow the other way it has been also been reducing the prevalence of dysmenorrhea, or if I say antifibrotic in nature. It is also reducing angiogenesis. Anti-proliferative properties are there. So why to go with the matcha when we have such a beautiful ingredient out here? A simple cup of tea, you have it warm, it's not going to be a harmful. But again, as I said, 2 moderate cups is fine. Don't make it beyond that. Phytoestrogens. Now, this is something like most of the time we face a question that, ma'am, what about the soya things, that should we consume it, should not it? See, in that case, I would like to highlight that phytoestrogens are of different types. If you go back today after this session, you will see phytoestrogens are of different categories. In that, we have the genistein, we have also isoflavones, we also have the linseeds also. There are many ways. Type of phytoestrogen, it's a matter of a thing. For example, if I talk about, there is like a phytoestrogen is known to somehow it's bind to estrogen receptors in the body, and somehow it is exerting weaker estrogen effects compared to the body's own estrogen, or even at times it's been found blocking the stronger effects of the endogenous estrogen. There are certain phytoestrogens which are found really helpful in that, but moderate consumption is the rule. So moderation is the key in there. You incorporate phytoestrogens, you cook well. See, when we say cauliflower should be omitted, my answer is, you understand the cooking process of that. If you steam it, you have it, it's not a problem. If you fry it, then it's going to be a troublesome. So always and always remember one thing, that incorporating phytoestrogens is not a big deal. Even in the latest research, it has been said that the inclusion of the soya flavones, isolates, I will be a little troublesome. But soya flavones, if we talk about, especially 2 to 3 times a week, or if you are adding soya products like tofu, miso, tempeh, especially these fermented products, if you are adding twice or thrice a week, it reduces the cases of endometriosis to a greater extent. But the only thing that we need to know the individual approach. Because as I mentioned, you may come across endometriosis, but with the variation. How about our some essential certain, we have the rosemary, we have the spices and the herbs, if I talk about, which have been found really helpful. Curcumin present in turmeric helps to control inflammation and the hormones. And if not to be mistaken, black pepper is the best friend to combine with. You have turmeric and black pepper, combine it, you can add it in your dishes, you even can make a paste of it and you add it in the milk as well. It is going to be really helpful. Rosemary, these days we come across that rosemary is really helpful in reducing hair fall, but at the same time rosemary is also found really helpful for the liver as well, because it helps to liver break down estrogen into a safer form and it helps with the hormonal balance. Coming to the lavender, coming to the chamomile tea, the essential oils, the essential component, that is the chrysin, which is present in them, not only calms down the nervous system, but also lowers the pain to a greater extent as well. There are certain phytochemicals which are really helpful in the management of the endometriosis. We came across about the green tea, that is the main component is epigallocatechin 3 gallate. Resveratrol, we get it from the red grapes, we get it from the red wine. If taken in the moderate consumption, then it shows antioxidant properties, anti-angiogenic properties, and it also inhibits prostaglandin synthesis via inhibition of the enzyme synthesis as well. Quercetin, apigenin, these all have been really helpful in shows anti-tumoral effects and inhibits the proliferation also. So with this, I would like to conclude my presentation. And now the surprise is actually I came across, since it is an endometriosis awareness session, so I came across a poem which is written by a person who itself is a endometriosis survivor. And the name of the poem is Stories of Endometriosis. And the story goes like this. Uh, and the story goes like this. A dull ache whispers, then screams as a rising tide. Endometriosis, a thief that dwells inside a story ached in pain. A woman's silent fight against a foe unseen, cloaked in the darkest night. Each month, a battle fought with gritted teeth, while normal life recedes like autumn's falling leaf. Some seek answers, years of searching lost and blind, their symptoms brushed aside, their truths left undefined. A diagnosis stings, a name to what they knew, but validation's balm, a strength to see them through. The cramping claws, the burning ache, a constant companion for goodness sake. The fatigue that lingers, a heavy shroud, dimming the spirit, silencing the proud. Within the struggle, a strength takes a root, a sisterhood forming a hopeful loot. But amidst the darkness, a flicker ignites, resilience blossoms in courageous sights. Women united, voices rise strong, sharing their stories where they belong. Loved ones standing with hearts full of grace, offering comfort in time and in space. For every tear that falls, a strength begins to rise, a hope for future cures reflected in their eyes. To break the chains of silence and finally be heard, these warriors of womanhood deserving every word. Thank you so much, everyone, for your patient listening. And I hope I
Excellent.
justified the thing. And any question, I'm
Jyoti,
good.
I wanted to ask a questions before any questions we are taking.
Please go
Just
ahead,
can you
ma'am.
explain just glutathione, significant role of a glutathione in this controlling of the endometriosis? So I just wanted to know about the role of a glutathione.
Yes, ma'am. So in that case, for the glutathione being an antioxidant in nature, so it has been found that it has been known to reduce the oxidative stress,
Yes.
and some or the other way, glutathione indirectly also helps in the tissue repair, collagen synthesis also. But yes, more researches are need to be done to understand the exact mechanism that how glutathione is helping. We can get glutathione in different supplements also, like we get it from the supplements are there, but to focus on the natural sources, we have very good fruit sources are there. We have the grapefruit, we have kiwi, we have even to certain extent we have the
Watermelon.
watermelon also. They
Yes.
also really helps a lot.
Okay. And we should explain some cooking procedures also to make that things that glutathione should not be destroyed. So overcooking and the
Yes,
boiling, some
overcooking,
percentage of
as I
boiling.
mentioned, if you are steaming, if you are broiling, if you are baking, it's perfectly fine. Grilling to certain extent, it's fine. But if you are over grilling it, then this is becoming a mess. So that
Yes.
again need to be taken care of.
There
Thank
is
you.
a
Thank you
question
so
by
much.
Ranjita. Ranjita, you can unmute and ask question. Then I will take Anonna's question. Anindita ma'am will take Anonna has asked for dairy product. But before that, Ranjita, you have a question. Please, can you unmute? Okay, Fatma, you can read out the
Rajita,
question, please.
please ask your questions, unmute. Fatma, you can ask the questions from the chat box.
Yes, sir, ma'am. There's a question. Anjum, can we reduce testosterone in women who are suffering? How?
No, ये आप बाद में पहले देखो उसके पहले जो क्वेश्चन है
So,
symphonic theory for
Rajita, you can type your
Samson's
questions.
theory of
Yeah.
retrograde. Yes, she already typed, while Samson's theory of retrograde menstruation is the most widely taught. It doesn't explain why 90% of women have retrograde flow, but only 10% develop the disease. This is her question.
I think she has stated the fact. She has stated the fact about this.
Yes, actually, she has just shared a fact about that.
Right,
fact
because
about
this
that.
is very true again,
Okay.
because this is like most of the time when we talk about the endometriosis, this is the retrograde menstruation is widely thing. But as I mentioned, endometriosis ka pathogenesis is actually emerging from the different ways. So when we are diagnosing it, we need to understand that where exactly is happening, and that is why proper diagnosis is a vital role. Like alone USG, alone blood parameters will not helpful. Like latest research has shown that this one particularly forgotten this name, yes, transvaginal sonography, TVS, this is considered as one
TVS.
such, you can say the diagnostic tool if you want to detect the bowel endometriosis.
Generally, doctors are doing for the pregnancy sometimes. For the time of the pregnancy, we are doing the TVS.
Yes.
So, but for the detections of the endometriosis, also it can be this diagnosis.
Yes.
For the diagnosis.
Yes, ma'am. Even there is one particular I missed out in this. There is a one particular biomarker also, but again, that's yes, researches are still going on. The biomarker is actually called as the serum CA125. This is actually one particular biomarker being identified right now for the endometriosis. But yes, long way to do. We need to do more study to make people aware about the fact.
Any other question, Fatma?
There are many questions. I want
Yes,
to
ma'am. One
take
question.
Jyoti, I have a
Medlina
question.
Dr. ma'am.
Yes,
Medlina,
Jyoti, before I ask the question, there is an excellent presentation you have
true.
shown. And mostly the important thing is the intensity of the exercise, because nowadays many of the patients have a myth that during this endometriosis there should be no exercise
True.
and all. So
True. I agree with her.
it's a really fantastic presentation from your end. So I have just one question. There is any relationship between the smoking point with endometriosis?
Thank you so much, ma'am, for this question and your kind words first. Yes, ma'am, to certain extent, there are researches which have been proving that smoking has been found in connection to the endometriosis thanks to the nicotine content. And the over smoking nowadays, people were like more getting fascinated about the smoking. Let's not blame only the males to the
Specifically
smoking.
for the female generation.
Yes, and
Yeah.
even the type of
Nowadays, the
the
smokers
smoke,
are more.
type of the smoking that is being used, like vapes, or if I talk about this, has a very detrimental effect on the endometriosis. It's even such a could be detrimental. It might even cause intrauterine bleeding as well, which it is not so very early detected, but later on when it becomes, it's very bad.
Okay. Thank you so much.
Thank you, ma'am.
Jyoti, I want to not ask only, I want to take your opinion as well as I want to highlight one thing before I go to the chat box or Fatma to ask for the chat box. So there is very good evidence for the probiotic, as you have already mentioned about the gut dysbiosis and all these, but there are specific strains of probiotic which are very helpful in this dysmenorrheic pain or preventing this reduction of this pain. So, especially lactobacillus gasseri, Gasseri, I saw one doctor to prescribe it. Then I put my interest and find that there are clinical trials that indicate that oral administration of specific strains of this particular lactobacillus bacteria is reducing the dysmenorrheic pain for the women who have endometriosis or PCOS. Even bifidobacteria, the card, homemade card are very
Yes,
good
sir.
lactobacillus.
Any fermented
So
products also they can use.
any fermented products are also very good. I agree with Anindita ma'am that it is very
And
good.
sometimes I feel, Shomindu, nowadays the women are so busy. Sometimes they are today here, इधर है, किसी time में Delhi जा रहा है, किसी time में abroad जा रहा है. So for those patient we are handling, तो in fact कुछ home remedies के बदले में अगर हम लोग कुछ probiotic अंदर मतलब commercial items भी use करें, that
कर
is also
सकते
good
हैं,
with the
कर
magnesium also.
सकते हैं.
Like
Yeah.
there is
Magnesium,
one evidence I want
magnesium,
to
yes.
highlight that since sir has mentioned about the probiotic strain. So in that case, if we talk about the curd, let's not forget even buttermilk has a even good consumption. Buttermilk, the type of the fat which is present, that is again not bad. And this fat has been really helpful for those patients who have hypertension, who has even CVD problem, along with this gynecological, especially this endometriosis. So the moderate age ones, like this was research done in the year 2013 or 14, back then I'm talking about it. But it is very helpful because buttermilk, again, the moment we hear it, it's like अरे बाप रे कितना fat होगा, but you are not understanding that alpha lipids, the lipids which are present in them, have been found really beneficial into this.
One more thing, Jyoti, I want to highlight. We do not check for the serum magnesium level. Serum magnesium level depletes and copper and zinc level, it increases. So it also contributes to the inflammation, oxidative stress, especially for the growth of the endometrial lesions for this kind of patient. This also I learned from a doctor and gynecologist. Elevated copper level are associated with the increased level of copper zinc ratio. If
Yes, sir.
you all the nutritionists who are here, please go through the very interesting thing because
And
especially in
also, I
mimicry.
would like to request everyone to go through about the low nickel diet as well as
Hmm.
the low nitrogen diet. This is
Low
again
nitrogen
really,
diet. About to
yes,
say that.
this is another emerging concept because these days we are also looking for the sustainable options, right? Like we are looking if that is something that we should adapt those food sources, or rather we should prepare the food in such a way that it is somewhat, it's not contributing much to as a carbon footprint. So I would request everyone to have an aggressive look onto this, because people will be coming up to you and say, like, low nickel diet, matlab ye kya hota hai, and all those. So we should be knowing these things as well.
Then we have to highlight about the cooking utensils also, preservation and cooking. That is also, I think, you will mention, na. And copper,
Yes.
which I was saying, na, this is very interesting fact that copper binds to the hormone receptor, and what it does, it interferes with the progesterone signaling, and it mimics the estrogen effects. So this high level can increase this estrogen production. So too much of copper toxicity or in elevated level of copper in the blood is also not good.
Good.
This is very highlighting topic. Acha, okay, move to the chat box, Fatma, and somebody has raised hand. So we will wind up within 10 minutes because running out of time.
Yeah.
Uh,
Irfan asking, how
ah,
can we increase our immunity level?
and she has also asked, I think somebody has asked for turmeric and curcumin, that is curcumin piperin effect. So any therapeutic dose, or you can recommend Jyoti to take curcumin and turmeric and black pepper, how they should take on everyday basis.
So
If
In the
she will,
morning.
basically, yes, somebody has said.
No, tell me.
Okay,
yes, well,
so in that case, turmeric and black pepper are considered as very good friends. And if you want to enjoy this benefits, you can add it like we prepare as an in the vegetable preparations we have. We also, what we can do is like this is a old theory, like our grandfathers, our mothers, grandmothers used to do it. Like in the you can actually take a water, you can prepare a decoction type, not every night I would say, but it's like the turmeric, uh, then black pepper, a bit of ginger, a bit of tulsi, maybe 4 to 5 tulsi leaves. You can prepare a decoction of that, and you can actually have that warm. That also helps in the detoxification. Now, there are some who have the raw turmeric at home. You can actually grate that, or you can make a paste into that. You can actually add a black pepper, the whole black peppercorns actually. You can actually mix this, and you can actually add it into the, you can in the milk also, or at the same time, you can actually have it like that. It is said with the with having that, especially on the empty stomach, it helps a lot. If somebody cannot have it again on the empty stomach, maybe after having a water or something, that can also be helpful. But turmeric and pepperine are something, very good friends, because pepperine actually increases the antioxidant activity of curcumin 3 times more. So definitely we can actually include that.
and better
Is
not
that
to heat.
tablet
Malika,
kind of?
do you want to? Yes, tablet are also good. Malika,
It's
do you want to unmute?
uh,
Malika
Yes,
Sharma,
sir. Yes,
boliye.
sir. Good evening. First of all, amazing session. I wanted to ask actually that isn't curcumin heat sensitive? So are we supposed to heat this concoction or just steam the turmeric and
You
prepare
can
this?
steam it. You don't have to again heat it too much in that way. That's why I mentioned you can just grate it, grate that
Yes.
thing, or if you add, once you have boiled the water properly, you can actually add that powder, turmeric powder. You can make then black pepper powder. You can mix it, and maybe just for 30 seconds you can boil the for the tulsi leaves if you are adding it. Otherwise, you can just avoid this
Better,
and you can have
better,
that.
better avoid use kacha haldi rather than the
raw
sukha
haldi, just like a,
raw
yeah,
haldi. Raw haldi is good
yeah.
than the sukha haldi, which is
Yes,
used in
raw haldi is any
shadi
time
My
fine.
marriage.
another patient, what she did, my patient did some, उसको ना बड़ी जैसा बना दिया, उसको ग्रेट करके एंड पाउडर ब्लैक पेपर मिला के थोड़ा कड़ी मिक्स मिला के उसको धूप मतलब धूप में सुखा के उसका जस्ट अ टैबलेट फॉर्म कर दिया. So every day, because nowadays we all are busy now, every day they cannot make a lot of things. So one tablet they
Neen-
are consuming in the morning.
Neena ma'am
Just
has
like
sent a beautiful comment for Jyoti, and she has appreciated a lot about your session. And there are many
Ma'am,
questions
excuse
coming.
me, sir.
Yeah,
Do we
I
need to add
Jyoti,
some fat in this? Let me tell
decoction?
you, very nice
I,
presentation. Would request you to send this paper for Jida. And
yes.
about curcumin, you can even have this kacha,
Yes, ma'am.
curcumin
Kacha haldi.
with a glass of water afterwards, warm water, just with, of course, pepper, a few peppercorns or something. You can just chew it.
True, very true. आयशा जी आप बोलिए आयशा जी
Sir,
Sir,
just
actually, in this decoction, do we need to add any fat or
No, no
curcumin is
fat is needed
no
to
fat?
add.
no
It
fat
is
is
going,
No,
it's nothing to add with the connection with the fat
nothing
there.
nothing to add.
Only curcumin and piperin is a good combination. Don't mix
Yes.
anything
so,
else.
ma'am, what is the best way to incorporate in our food? Because many people add turmeric while preparing their meals, and it is boiled and heated. As we all know, the conventional usage of haldi. So, what
I
is the best
think
way to
I
consume it
think
so that
best
we could get
way.
immunity?
I think what I would suggest you to try to make sure to incorporate the raw turmeric. That would be really helpful in that way. Raw
That will
turmeric,
I always do. I always do raw turmeric.
you can act, even you
Right.
can do something like one of my cousin did this. Raw haldi, you grate it, you can make a paste with the honey and you can actually have that just for that taste to avoid that
Only
kadavapan
for the
also.
taste. Only
Only
for the
for the
taste you can
taste.
add honey. What I used to do for bache for the children, I asked them to make in a mixture juice,
Mhm.
turmeric juice, store in a not a plastic bottle but glass bottle. You can store whenever you are giving. You add little bit of black pepper, add water or whatever Jyoti said with honey also can give. And for us, for the adults and for the women, they can chew टर्मरिक जो छोटा छोटा पीसेस
Even
होता है ना you chew it
yeah,
and
even I
Thank you,
think
sir.
one thing I can incorporate sometimes for the endometriosis patient, we can add some folic acid also. So the handful of the
somebody has
raisins and
written
the 10 pieces of the raisins after having this bad taste, the curcumin and the piperin. So they can chew the raisins, soaked raisins, yeah, dates also. So they can have the iron intake, but more they can incorporate the iron intake also.
one more important question because we are running out of time. So wonderful session Sri Chaudhary has said if patient is suffering from endometriosis and also having hyperthyroidism, so then we will suggest soya products or 2 3 days in a week or kindly sir. Yes, soya products highly can be suggested for the thyroid patient if they are taking the commercial one like Nitrela or Potin. They are already processed, so you can just soak
Boiled.
in the water and or boil and drain the water. But
Yes.
I will come to Jyoti. What about soya powder, soya atta and soya oil for the hypothyroidism patient? What is
For
your
soya oil, I would say a big no because soya oil contains omega-6 fatty acids, a hell lot of a good amount. So
inflammation?
soya oil is a big no for the hypothyroid patients as well as the patient who has this endometriosis problem. Coming to the soy ones, I would say the fermented soya products which we get these days, like tofu. If I talk about the miso tempeh, recently they have been emphasized more. Soya atta today in time, if you want to make it, you can make it fresh at home. Get the whole soya bean from the
Whole
market,
soybean.
and actually you can make the atta out here. Because what we get there, it's completely processed. What if
Yeah.
it may
Yes.
mimic like an xenoestrogens? So
Yes.
instead of benefiting, it will actually act opposite towards. It would turn like an enemy in our body. So it's better if you can prepare it at home level.
And another thing is that they are feeling the little bit bloating after having the
Yes.
soya atta kind of things.
Yeah, so that
So
is
they're
because the processed one, ma'am, because
yeah.
the way it is processed, that also
Mm.
matters a lot. The
Yeah.
processed foods, if we talk about in this way, so that actually mimics and in the
Yeah.
way it blocks the estrogen activity. So better if you can, if it is possible, try to make it fresh at home. And soybean, whole soybean is quite, I would say, a lesser cheaper again, lesser inexpensive that we get from, like if we compare it to the moong dal or masoor dal in today's time. So you can actually make atta out here.
And the
Jyoti, one
questions
more
question.
question from Padmaja Nandi. Excellent presentation. Can we know iron overload often worsen the endometriosis? So can you suggest how the iron load should be minimized or maintained or reduced for this inflammation purpose, iron overload?
See, in this case, for the iron overload, I would suggest that you need to first understand that which are the sources. Like there are iron sources available, like we have the animal sources also, and we also have the plant sources as well. Now, plant sources may iron come, they have the oxalates as well. So somehow it can be contributing to the overloading factor. Now, again, at the same time, if we see there are researchers again, there are researchers going on in that case. So maybe later on, I can actually help you out, Padmaja, that how we can actually reduce this,
Yes,
how
Ranjita,
to
I'm coming.
identify the
Wait.
iron overload about it, because it is a bit in that aspect, because the studies are still going on in that way.
Hello, ma'am. Can I ask a two question, please?
Yes, yes. You
Please go
and
ahead.
Ranjita. Go
Yes.
ahead, please.
First
I
of
am
all,
about to ask you only. Okay,
yes,
thank you.
it was a amazing session. I have to say, amazing session. I have two questions. For the PCOS person, I see almost they are suffering for the low immunity. How can we improve that? And my second question is, can we reduce testosterone level in women who are either
Yes.
endometriosis, either PCOS, PCOD, etc.? These are my two questions.
Okay. Ifra,
First of
thank you
all,
so much for this question.
can you just highlight आप स्टूडेंट हो, आप प्रैक्टिसिंग हो, आप हॉस्पिटल में हो, कहाँ पे हो, या अभी पढ़ाई चल रहा है आपका?
I'm practicing. I'm a dietitian. I'm practicing, taking OPDs.
ओके ओके, देन तो आपको ये पता होना चाहिए. ज्योति मैम उसके ऊपर हाईलाइट कर देते हैं.
So
ओके.
my answer to you is the first for the both the question, the answer is include antioxidants. We have such beautiful food sources which provides immense antioxidants. For example, if I talk about amla, how many of us
मैं
are actually aware about it that
मैं
amla
एवरी
has
पेशेंट को देता
immense
हूँ, मेरा एवरी पेशेंट को देता हूँ मैं
vitamin
आंवला.
C, and if you have it like in a small with a small pieces every day, maybe in the form of a chutney, maybe in the form of like in any way form, actually not in the form like crushed amla also, that is going to be really helpful. Second, if we talk about the other inclusion of the vitamin C rich foods are there, we have the vegetables out here. And the most important, again, the thing is that after antioxidant, if not to be mistaken, the immunity level can be best improved if you include exercises. We just highlighted about that how the type of aerobic exercises can be helpful. Start with the brisk walk, then to the come to the running, swimming. We have you if your clients, if you come across your patients who love sports, tell them to have to enjoy and play the game without any stress. That's
And
more
even sleep
important.
quality also they should improve, because
Sleep
nowadays
Ma'am,
sleep
just
quality.
deprivations is much
Yes.
just
common
बोलिए
for this
बोलिए
periods.
बोलिए.
uh,
Second,
just
Yes,
to
if
testosterone.
con
Second question is testosterone. She was asking
yes,
how
just to
to
continue
reduce.
with you, ma'am. I am suggesting my patient tulsi plus ginger plus turmeric plus black pepper and with the raw amla juice. Okay, every morning in the
Yes.
empty stomach,
okay.
and she has a drastic improvement.
Mm-hmm.
Apart
Very
from
good.
this, is there anything like whatever you mentioned is absolutely fantastic? That is a great effective way of improving immunity levels. But I wanted to know, is there anything more on it?
See, as I mentioned, exercises can really helpful. I think you can tell the patients to include walking or maybe the meditation, because yes, where food is also playing a role, I think it's a balance between the food and the exercise as well. That will actually help to improve the immunity levels.
Ifra, I want to add something. If you are practicing this thing, you have to first know the dietary habit of the patient. Why he is
Mm.
suffering from the low immunity level. Maybe some reason behind that. You have to first take a diet note, diet history. what he or she is taking, what he or she is living with the sedentary lifestyle, as Jyoti has told you. So everything you need to check, then you can this thing you can yeah, calculate your diet chart or design your diet plan.
Yes, ma'am, for sure. Thank you so much for the suggestion, ma'am.
Thank you, dear.
Ranjita Bosch. Ranjita, last question, please. Ranjita Bosch.
Good evening, everyone, and I'm sorry for that time I couldn't unmute myself. Thank you, ma'am, for the insightful talk. Ma'am, I have one question, that is, ma'am, endometriosis lesion can produce their own estrogen via, as we all know, that via aromatase activity. So, is it medically accurate to call a hormonal suppression a treatment, or we just simply masking symptoms while the disease remains active in our body?
Ma'am, can you repeat the question again? Sorry, it was cut in between. The voice was cut in
Sure,
between.
sure. Ma'am, my question is that if we all know that endometriosis lesion can produce their own estrogen via the aromatase activity. So, is it medically accurate to call hormonal suppression a treatment, or just we must simply masking symptoms when the disease remains the same in remains active in our body? So, I have a little query about it.
I'm not clear of the question.
Yeah, can you please
Just
explain
wait,
your
please, not
questions?
yet.
Because the
Actually,
questions.
I'm not getting exactly what is she
Yeah,
saying.
can you please explain the questions little bit? What you wanted
Should
to
I
know?
write it down? Is there any way that
Actually, क्या
You can
questions
say
था?
in Hindi, yeah, Bengali we can understand, but maybe we are
Can
not
you please
getting.
explain what you wanted to know from us?
বলতে চাও তুমি বলো, বাংলায় বলো, we are comfortable in Bengali. বলো।
ম্যাম, যে এন্ডোমেট্রিওসিস যে লেশন, ওরা তো নিজেদের ইস্ট্রোজেন হরমোনটা প্রডিউস করতে পারে যে অ্যারোম্যাটেজ অ্যাক্টিভিটি দ্বারা, কিন্তু আমার প্রশ্ন হচ্ছে যে এটা কি মেডিকেলি সঠিক যে আমরা এটাকে হরমোনাল যে সাপ্রেশন জিনিসটা হচ্ছে সেটাকে ট্রিটমেন্ট বলা, বা আমরা শুধু সিমটমস গুলোকে একটা মাস্ক করে রাখছি যে না দি সিমটমস আর উই আর মাস্কিং, রাদার দেন যখন আমার বডিতে ওই ডিজিজটা অ্যাক্টিভ ভাবে প্রেজেন্ট আছে।
দেখো, এস্ট্রোজেনটাকে আমরা সাপ্রেস করে দিচ্ছি, মানে কিছু মেডিসিনস দিয়ে ওটাকে আমরা ওভারগ্রোথ করতে দেওয়া হয় না। সো হোয়াট ইজ দ্য থিংস, আমাদের টিস্যু গ্রোথ হয় আউটসাইড দ্য ইউটেরাস। যত আমরা বেশি এটাকে প্রডিউস করতে দেব বা বেশি ইম্প্যাক্ট করতে দেব, তত আমাদের টিস্যু গ্রোথটা বাড়তে থাকবে, পেন অ্যান্ড ইনফ্লামেশনসটাও বাড়তে থাকবে। ফর দিস ট্রিটমেন্ট দে জাস্ট ওয়ান্টেড টু সাপ্রেস দ্য হরমোন, যাতে করে আর ওভারগ্রোথ না আসে। দ্যাটস দ্য রিজন ডক্টরস আর গিভিং দ্য সাম প্রোজেস্টেরন and some different কাউকে রিং দেওয়া হয় বা মেরিনা দেওয়া হয়, ইনসার্ট করানো হয় কাইন্ড অফ, যেখানে বা প্রোজেস্টেরন দেওয়া হয় ফর আ কাপল অফ উইকস বা কাপল অফ মান্থস বলতে পারি, 6 মান্থস বলতে পারি, যাতে করে আর এস্ট্রোজেনের এফেক্ট না আসে, এন্ড যতটা রয়েছে সেটাই থাকে। মানে এক্সট্রা আরো যদি এস্ট্রোজেন পায়, তাহলে তো সেক্ষেত্রে আরো বেশি ওর ওভার ইনফ্লামেশন তো হবে, ব্লিডিংও হবে, প্লাস পেইনটাও বাড়তে থাকবে।
Actually, my problem is that we as what I suggested as healthcare professionals, অনেক সময় কি হয়, when patients are coming to us, doctor has maybe prescribed them the hormonal therapy, but patients will not take those hormonal pills thinking कि periods रुक जाएगा, artificially हम उसको treat कर रहे हैं। So I think we are the ones who have to guide them. Yes, because we are the ones who have to guide them कि डॉक्टर जो बोल रहे हैं उसको सही तरीके से मानना है, not put their brain into that and then ChatGPT and Google
actually doctor
it is very important
doctor we suggest something. I know उधर का जो साइड इफेक्ट होता है डॉक्टर्स का प्रेस्क्रिप्शन का, वो साइड इफेक्ट को हम लोगों को डिलीट करना होता है, बिकॉज कुछ पेशेंट्स है जिन लोग एवरी वीक्स इंजेक्शंस ले रहे हैं उसके लिए कई सारा साइड इफेक्ट होता है। सो दैट पार्ट्स वी हैव टू टेक इन केयर ऑफ, बट वी शुड नॉट सजेस्ट कि उसको मेरिना देना है या प्रोजेस्टेरॉन देना है या एस्ट्रोजन सप्रेस करना है, क्योंकि इट डिपेंड्स अपॉन द टीवीएस जो बोला ना, करके देखने का कितना एंडोमेट्रियोसिस कौन सा एरिया में कैसा सिचुएशंस में है। सो और इसके लिए पूरा डॉक्टर्स का ही व्यूज देंगे, क्योंकि वो गायनेकोलॉजिस्ट स्पेसिफिकली जो कौन गायनेकोलॉजिस्ट क्या चाहते हैं, इट डिपेंड्स अपॉन देम। And even one patient.
Ma'am,
अगर कोई-
actually, this thing you can highlight for GLP therapy as well in that case. This is one thing that is a common notion there as well. Because these patients, mostly we also get to be overweight. In that case, also patient could get brain. Because of the side effects, people are not going for the drugs. But that's not the right way to go. We are the ones who are going to treat the symptoms and make the life
Gynecologists are
easier
sending
for you.
us that
For the patient.
endometriosis patient, because to make the controlling of for the controlling factor of the obesity, because they are putting a lot of weight. एवरी डे तुम लोग वेट पुट ऑन करते हैं और कुछ भी करने से वेट पुट ऑन करते हैं, तो उसके लिए भी उसका एक स्ट्रेस होता है. इवन एंडोमेट्रोसिस में बहुत पेनफुल सिचुएशंस, उसको हम लोगों को काउंसलिंग के थ्रू हैंडल करना पड़ता है. एंड इवन द गुड लाइफस्टाइल अगर हम लोग देंगे तो डेफिनेटली इन्फ्लेमेशन, एंटी इन्फ्लेमेटरी डाइट वी शुड प्रेस्क्राइब. And lots of nuts and seeds, जो हम लोग कह रहे थे ना, ग्लूटाथायोन and selenium combinations. I saw many patients जो उन लोगों को वो बेनिफिट मिलता है. तो इतना ही, जितना ब्लोटिंग, कंस्टिपेशन हम लोग अवॉइड कर पाए इतना. बट एस्ट्रोजन थेरेपी और जो एस्ट्रोजन सप्रेसिंग थेरेपी जो देते हैं या उसको 6 months के लिए पीरियड्स बंद रखेंगे, इट्स एक्चुअली डॉक्टर्स डिसाइड करेंगे कैसा सिचुएशंस में कौन सा ट्रीटमेंट उनके लिए बेनिफिशियल है. It's not part of our
for clearing my concept. I asked this question because, ma'am, doctors often think that we are giving the hormonal suppression often to mask the symptoms. But as you have cleared that it is not to mask the symptoms, but to cure the disease for a long term until we haven't cured the endometriosis.
Manage the disease. You will not use the word cure, but manage the disease for a long time.
Because these issues are similar to, these are not, we cannot say them as diseases. These are actually disorders. Like diabetes कभी cure नहीं हो सकता. In the similar way, these diseases cannot be cured. You are just going to mask, you are just going to manage the symptoms. And that is only the way that it can be done. Whenever we say to our patients, I will be able to cure it for you, you are wrong in that case. We also have to get into the habit
That is why
give a proper
endometriosis
education
is a
that it
needs
is
real
a
medical
disorder इसको
attention.
manage भी किया जा सकता है. That is also very important.
Until
It is
until they
managed, it
completed
cannot
their
be cured.
reproductive age, जब तक ना complete होता है reproductive age, तब तक वो manage करना ही होगा. With through the lifestyle modification, through the medications, through the injections, or through the surgery, whatever the convenient for this patient's particular patients.
Thank you, ma'am, for clearing my doubt. Thank you so much.
Interrupt, can I
Thank you,
ask?
Ranjita.
We have to
Yeah,
wind
I
up
think it's
just
the last
in
questions.
given
Actually, we have to
given
submit some thanks also.
WhatsApp or mail.
Yeah. So today we can just
Over to the vote of
the-
thanks.
Yeah.
Malika ji, you put the question in the given WhatsApp or mail.
Like to
and
answer it.
I hand over to Anindita ma'am and Khushboo.
Yeah. Thank you so much for this today's sessions. Thanks a lot, Jyoti. And thank you all the participants who are here till now. And I should thanks IPEN मतलब today क्योंकि IPEN नहीं होता तो हम लोग एक साथ इतना टाइम शाम को पूरा एक नॉलेज शेयरिंग के लिए प्लेटफॉर्म ही नहीं मिलते हैं. तो I have to acknowledge IPEN, हम लोगों का जो प्लेटफॉर्म्स है उसके लिए हम लोग नॉलेज शेयर कर रहे हैं. And the more awareness programs we are looking forward to. And I would like to thanks NEC, our loving Shambhavik Tradi, and thanks to Chapter President Dr. Mahesh Jansari sir. I would like to thank the Chapter Vice President, our loving Ipshita ma'am, and thank you so much Shudeshna Di for being with us, this our Chapter Secretary. Thanks a lot. Thanks Shomendu. Thanks Khushboo, and thank you all the participants with us. Thanks a lot and good night.
Thank you, everyone. Good night.
Thank you, everyone. Good night.